started in pediatrics actually in medical school in 1973-74 and have been involved in pediatrics ever since then. Seeing the move from 40 years ago to where we are now, where so many of the diseases are essentially non-existent or unheard of or so uncommon that we've effectively reduced the incidence of diseases to a rate where children are not being ill for long periods of time, not dying, not suffering. My personal experience has been to observe diseases such as Haemophilus influenza, pneumococcal disease, meningococcal disease, and measles, mumps, chickenpox diseases essentially be eliminated through vaccines. And the science of vaccines has advanced dramatically in those 40 years. The vaccines are incredibly well researched, incredibly safe, and very effective. My belief is that when we talk about vaccines for children in Vermont, it's a public health issue. I believe that vaccines protect not only the children getting the vaccines, but the other children around them. Certainly there are children who have medical reasons why they can't get vaccines. There are children who don't respond to the vaccines, and as a result, by immunizing all children who especially are attending public schools, we protect the other children. When we look at the public health issues of immunizing children, I think it is the state of Vermont and I think the government's role to protect children. And I think we have a history of doing that. And some of the things I've talked about in the past, we now require that all children be in proper car restraints. We require seat belts. We don't allow 10-year-olds to work in sweatshops. We don't allow children under 21 to drink. Children under 18 are not supposed to be smoking. All of these are designed to keep children safe and healthy and protect them. I believe the immunization law is equal to those. And in some ways it may actually be more important. Vaccines are an incredible investment in the health of children long term. Up front, when we go out and buy vaccines and give them, it's costly. We don't make money in our pockets over that, but in the long run, we save huge amounts of medical dollars by keeping the children healthy. The most important thing that we can do is continue to educate parents and shoot down the misinformation that parents are getting from a variety of sources in a face-to-face discussion that needs to be continuous over time. I believe very strongly that I will care for any child that comes to my office, whether they're vaccinated or not, but I will continually try to educate parents about the need for vaccines and the safety of vaccines.